I am Dr. Malik. Today we will talk about an important fever. The, the only fever, I can say this is the only fever nowadays dominating. It is dengue. We are not seeing malarias, we are not seeing typhoids, we are not seeing all these fevers. We are seeing only dengue fevers, That has become very, very, very prominent. Okay. So what is exactly a dengue fever? We are losing cases and the patients are becoming very, very serious. There lot of money is involved, and lot of strain is involved to the patients. So concentrate on this fever, dengue fever. Dengue fever is caused by an RNA virus. See, dengue virus is an RNA virus and it is injected by Aedes aegypti mosquito. Aedes aegypti mosquito, we all know it. Hussain Sagar, you go to Tangmad, you sit there in the day for a while, you will definitely get a Aedes mosquito bite in the day, because this bites in the day. Aedes aegypti mosquito. You must have seen these mosquitoes. They will have white and black stripes, and once that mosquito bites, and once this RNA virus is injected into your body, so 4 to 10 days, within 4 to 10 days, that is the incubation period. Within 4 to 10 days, you are likely to get dengue fever. So what exactly are the stages of dengue fever? Okay. Number 1, there are 4 stages. Dengue without warning signs. What is sign? What is symptom? Symptom is the thing which patient comes and tells the doctor. Yes, I have vomitings, I have high fever. This is what patient says. That is called symptom. Whereas signs are the things which the doctor sees in the patient. The patient, when he comes and the doctor examines, these are the things which doctor sees in the patient. Those are the signs. The doctor can see it. Okay. Number 1. So dengue without warning signs. This is most of the 70% of dengue cases stop here. Okay. It is usually from first day of fever to 7th day of fever, first week. Usually there is very high grade fever. There is headache. There is retroorbital pain. The patient says, I have severe pain in the orbital area behind the eyeball. Whenever I move, there is severe pain in the eyeball. And there is something called break bone fever. All the muscles are painful, all the bones are painful, all the joints are painful. This is called break bone fever. And there will be rash over the body, like the rash you will see in measles. There will be red spots, and once you just catch them like this, they disappear for few seconds. That is called blanching. So this blanches. That rash blanches. Okay, this occurs from 1 to 7 days. There will be high grade fever. The patient comes to the doctor in this stage. But the only thing is, there is no big treatment. It's a virus. So simple dolo or whatever we give, and we only caution the patient that this will be there for 1 week, and after 1 week, the second stage can start. It can disappear here. The problem can stop here, or it can proceed. Usually the patient relaxes because the fever comes down. Then the second stage starts. It is dengue with signs. In 70% of the cases, that will not occur. Only it stops at the first stage. But in some cases, the situation goes to dengue with signs. Now the signs will come out. What are the things? This is the second stage. There will be abdominal pain. Pain in the stomach. There are vomitings. There is pleural effusion. What is pleural effusion? I told you this is a sign. Pleural effusion is collection of fluid in the lung coverings. Lungs are there. There is a cover called pleura. There is collection of fluid in the lung covering. That is called pleural effusion. And ascites means there is collection of fluid in the abdomen also, okay. And the hematocrit will raise. When you go to a blood test at that time, what happens is all your cells are high, your red blood cells are high, your hemoglobin is high. The reason is you are losing fluid from the blood vessels. From the blood vessels, you are losing fluid into the tissues. This is called third space losses. From the blood vessels, the fluid is coming out, and the water or the fluid is coming out. 70% of our body is fluid. The fluid is coming out into the third spaces like lung tissue, they're not lung tissue, lung coverings, abdomen, peritoneum, we call it abdomen, like that. So in this situation, when you get a blood test, all the hemoglobin rises, the red cell count rises, everything, RBCs rise, everything rise. Next, gingivitis, there will be these gingiva, they will swell, the gums swell, and from that there will be bleeding. And epistaxis, bleeding from the nose. These are the stages in the second stage, very, very, very important. You must come back to the doctor immediately. Then the third stage comes, severe dengue hemorrhagic fever. The third stage, severe dengue hemorrhagic fever. This will only occur once there is a second bite. After the first bite, you have dengue fever. If there is a second bite, only this occurs. Second bite with a different RNA strain of dengue. That is important. Second bite with a different RNA strain. Then you will land this dangerous situation called severe dengue hemorrhagic fever. There will be bleeding inside. There will be bleeding. Fever again shoots up. The hematocrit, what I told you, the RBCs, all the blood cells, the hemoglobin, everything, they start falling because there is bleeding inside. It is not fluid going out, it is blood going out. So there will be hemorrhage, there will be mental confusion. The platelets will come down. Usually 1.5 lakhs to 4.5 lakhs is the normal platelet. It will come down to below 1 lakh, or below 50,000, or below 30,000. We get most of the patients at 10,000, 15,000. Most of the patients come to us at that stage. He may not bleed inside, but he is about to bleed. That is the thing. So this is the third stage. And the last and the final degree is dengue shock syndrome. It is the most dangerous situation where you are almost practically losing the patient. You need a very higher center for this treatment. So dengue shock syndrome, where there is a very good ICU, where there is a very good setup, then there is a chance of survival. Okay. Dengue shock syndrome is nothing but the BP falls. What is shock? The BP falls, the pulse falls. That means pulse, not the pulse rate. You are not able to feel the pulse. It is so low. The volume is so low. Sometimes there will be severe tachycardia, like 120, 130 per minute. Heart rate will be 131. Pulse rate will be very high. But it is very 3D. You are unable to feel it. And the BP is very low, like 80, 70, like that. So this is called dengue shock syndrome. Severe dengue hemorrhagic fever with shock. This is called dengue shock syndrome. So please be careful at this stage. It's very, very important. After knowing all the four things, like dengue without signs, dengue with signs, severe dengue hemorrhagic fever, dengue shock syndrome. These are the four stages of dengue fever. Now, what are the tests to be done and how do we treat it? Number one, first test will be CBP, that is complete blood picture. What it gives, your white cell count, your red cell count, your RBCs, your WBCs, your white blood cells, your red blood cells, your hemoglobin, and the percentages, your platelets, everything. And number two, the dengue test, you must get it done as early as possible in the first week, as early as possible. The first test that becomes positive in the first week, that is in the second or third day, this is NS1 antigen, dengue antigen. NS1 antigen is the first to become positive. From second day onwards, it becomes positive up to 1 week. Dengue antibodies, they become positive only after 4 or 5 days. only after 4 or 5 days. So NS1 antigen, dengue antigen, you first get it done. If it is positive, you start the treatment, and dengue antibodies after 4 or 5 days. After 4 or 5 days, because dengue antigen after 1 week it may not be positive, and dengue antibodies become positive after 4 or 5 days. So next test is PT-INR, your prothrombin time and INR. This will tell you whether there is any bleeding tendency. If PT is high, if INR is high, you may have bleeding tendency. If the platelets are low in CBP, immediate attention should be paid, because platelets are low, then there are chances of bleeding. Next comes the treatment. See, dengue without signs or with signs. See, initially the first 2 or 3 days, no need of anything. Simple dolo, that is paracetamol, or if the pains are high, you can take Ultracet or any other painkiller. But mainly dolo or paracetamol, you can take it every 3 to 4 hours, 1 tablet daily. You can take 4 or 5 tablets or even more also, if the pains are heavy. And Ultracet can be taken at bedtime to get relief. So these two are the only thing recommended, not much, because this is a virus. Wait for 2 or 3 days. Then, see, you will definitely come to the doctor once there are 2 or 3 days of fever is over. Generally, first 2 days, no need of any doctor, because it's basically viral infection. If it comes down, there is no problem. But if it continues on 3rd day or 4th day also, then you need to come to the doctor, and they get this NS antigen test. NS antigen, if the dengue is positive, usually even if the dengue is positive, you need only close monitoring. There is no need of antibiotics or steroids, because this is only a virus. But once you come to a doctor, hospital, we are supposed to give antibiotics, because we are not sure. Along with the virus, there can be some bacterial invasion also, secondary bacterial infection we call it. So we give antibiotics. We are giving antibiotics. Our physicians are giving antibiotics. Usually it is doxycycline. Morning, evening, and something like Mahacef Plus, tablet Mahacef Plus, which contains cefixime with ofloxacin, 200 mg, one in the morning, one in the evening. But usually 3rd day or 4th day of fever, we keep it IV. We ask the patient to get admitted, because the platelets, there is a chance of drop in platelets. So this is IV. Doxycycline is given IV, and ceftriaxone injection, monosef, is given IV, morning, evening. And steroid is also not recommended. But if the platelets are stalling, suppose the platelets are coming down below 1 lakh, then we give injection Solumedrol, that is methylprednisolone, 1 gram, at least 1 dose a day. We are giving ours to safeguard, but really speaking, it is not effective. But we give. And the thing is, if the platelets are coming down below 1 lakh, you have to be cautious. And one more thing is, if the platelets are coming below 50,000, you need hospital admission. And if the platelets are coming below 30,000, because we are getting more patients with 10,000, 20,000 platelets. So below 30,000, you need platelet transfusion. You have to get platelets and give it. You have to, in blood banks, platelets are available. And if there are any chances of bleeding, if you have any doubt of there is bleeding, you have to give fresh blood transfusion. Along with platelets, you have to give fresh blood transfusion. That is, ask one of their relatives to donate blood, 1 or 2 packets of blood from relatives, give it immediately. Fresh whole blood transfusion, not fresh whole blood transfusion, okay? We give it fresh whole blood transfusion, because there are chances of bleeding. We are giving fresh whole blood transfusion. We don't know, somewhere he must be bleeding. If the BP is little coming down, we are extra cautious and we are giving whole blood transfusion along with platelets. If it is fresh blood, then it also contains lot of platelets. If it is stored blood, it will not contain platelets. That is one more thing. And see, if the situation is crossing, if the situation is crossing the limit and you are going to dengue shock syndrome, the BP is falling and the patient is deteriorating, immediately we resort to ventilator. Immediately we resort to ventilator and we put the patient on noradrenaline infusion, noradrenaline, that is inotrope, to increase the BP and all. And we constantly monitor every ICU aspect like your urine output, because there is a chance of multi-organ failure. So we have to take care, and you may need ventilator and you may need higher antibiotics like injection meropenem and lenazolide, etc. All these higher antibiotics may be needed, but only doubtful. Their use is only doubtful. We are giving only as a precautionary measure, only as a life-saving drugs. And you need to have all the life-saving precautions when there is dengue shock syndrome, almost like you treat any other severe septic patient or any other serious patients. You go for fresh blood transfusion, fresh whole blood transfusions, platelet transfusions, everything, whatnot. You are about to lose a patient, you give everything, you try everything. Yes, this is what is going to be done completely in a good ICU setup. We cannot neglect these things. Please be cautious about this. Dengue is a life-threatening disease. Fever, life